So you've probably seen in the news that public health does something called contact tracing when there's a new case of COVID. What is contact tracing? So public health nurses, when there's a reportable disease, of which there's quite a long list, but COVID is one of them, they do an investigation and basically function like disease investigators or disease detectives. So it's their job to try to figure out what happened. How was this person exposed to COVID, and who else might have been exposed to them once they were infectious? So the first thing they do is they call the person who has the positive test result and figure out everywhere that they have been and everyone they've been in close contact with since their symptoms started, and they will actually even go back 2 days before symptoms started just to be extra sure that they're capturing everyone who might be at risk. So they're going to explore everywhere they were in public, people that live in the same household, people that they work with, any social gatherings they may have been at, and they will write down every single person that they believe that may have been in contact during that period, and then those nurses will call all of those people. When they call the contacts, they first off inform them that they've potentially been exposed to the virus. And then the second thing they do is give them information about what to watch for. So what are the symptoms that they need to watch for? What should they be doing right now? The short answer is isolating and staying at home. And if they do start to have symptoms, what do they do then? Additionally, they're going to do some exploring with the case, the person who tested positive, to try to figure out where they may have gotten the infection from. So are they a contact to a known case that we already have? Have they traveled recently? Do they work in a lab where they may have been exposed? The purpose of all of this is to try to catch the virus before it spreads and notify everyone who might be incubating, meaning holding on to the virus before symptoms start, and getting them isolated so that they can't spread it while they're either asymptomatic, so while they don't have symptoms, or once they're in their early stages of symptoms but don't actually realize how significant it is yet. So that's what public health does. So if you think you've been in contact with somebody, you can call HealthLinks for further information, but do be reassured that if public health thinks you're at significant risk to a known contact, they will call you.